Welcome to Friday's edition of COVID-19. Korea's daily tally is holding steady today on the 600 level. Accordingly, authorities have decided to maintain current social distancing measures for 3 more weeks, starting from the 3rd of May. And as our vaccination campaign gains momentum, there appears to be growing interest in our immune system. Now, we have details on this later on in the program. Here first, as always, is our Kwon-Soa.
Hi, Sunny. We'll have 600s again for the second straight day, as is said, but we are seeing a slight decline to 661 infections as of 12 a.m. this Friday, and that includes 642 domestic infections and 19 imported cases. And with that, the total number has surpassed 122,000. If we take a look at where these infections occurred, almost all across the nation, we're seeing over 220 cases in the capital, Seoul, followed by around 150 in Gyeonggi-do province, and also quite a surge down here in Ulsan with more than 60 cases. And not a big change in the shift. There's not a big shift in trend here, but we are seeing an on-week drop when we compare the figure from last Friday.
I see. On the with regard to social distancing measures, that is, the government has decided to extend it, like I mentioned earlier.
Right, Sunny, for 3 more weeks. So starting next Monday until May 23rd, level 2 social distancing measures in the capital region and level 1.5 elsewhere, plus the ban on private gatherings of 5 or more people. So that announcement was made this Friday, with authorities citing little change in daily tallies, but also national holidays such as Children's Day and Buddha's birthday coming up. The reason why measures have not been raised has been attributed to more people having turned to outdoor activities due to restrictions on nightlife entertainment venues in the metropolitan region, as well as a decrease in cluster infections among the elderly, thanks to prioritized vaccination at high-risk facilities for seniors, and enough capacity in hospital beds to treat critically ill COVID-19 patients. Officials also hinted at a gradual return to normal lives around summer.
We can stem the risk of COVID-19 if daily caseloads are maintained below 1,000 until the end of June and vaccinations for the elderly progress smoothly. If this is achieved, we are planning to revise our social distancing rules, such as regarding the ban on private gatherings and business restrictions at around July.
Of course, that's only possible if the vaccination process continues swiftly. The government has reached its end of the April goal of 3 million yesterday, with a rise in daily vaccinations. Also, more than 30,000 people have received their second shot yesterday. And just today, President Moon Jae-in also received his second AstraZeneca shot, while yesterday the Korean Olympic delegation has received their vaccinations. Our Sung-yeon will go into the details in a bit. But speaking of the Olympics, host city Tokyo has confirmed more than 1,000 infections on Thursday, topping that mark for the first time in 3 months. Now, despite being under a 3rd state of emergency on Thursday, with the beginning of a Golden Week holiday there, traveling has risen by up to 3.3% in some major regions. What's also risen is the daily number of infections around the world, over 902,000 infections as of noon Korea time. And a quick look at some serious spots around the world. Here, the U.S. hit 33 million, 18.7 million in India, with almost 380,000 new cases. And Italy here has hit 4 million infections in total. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, thank you for now then. Right, as Soa mentioned earlier, authorities here have secured their goal of offering the first dose of the COVID-19 vaccine to 3 million people. Now, for more on this, I have our Kim Sung-yeon here in the studio with me. Welcome, Sung-yeon.
Good afternoon, Sunny.
Right, so Sung-yeon, as of late Thursday, more than 3 million people have received their first shot.
Right, so I did talk about the 2 million mark last Friday here on the show, and then in just a week's time, we've reached the 3 million mark. So certainly the country has been scaling up its vaccine rollout to reach herd immunity by November. Now, Korea has reached the milestone of 3 million 62 days since its public vaccination campaign kicked off on February 26th. With that, the country has inoculated roughly 5.6% of its 52 million population, according to the KDCA. And on Thursday, the most number of people were vaccinated in a 24-hour span.
Yesterday, we saw the most number of daily vaccinations since the start of our inoculation campaign, thanks to the expansion of our vaccination capacity.
Health authorities are looking to administer first doses to 12 million people by the end of June and 70% of the country's population by September to reach herd immunity by November. Now, Korea's vaccination campaign got off to a slow start initially as the early shots were only available for residents and staff at nursing centers, and it took the country 39 days to reach the 1 million mark. But the country passed the 2 million milestone 17 days after that, then 3 million in a mere 7 days, so the rollouts are gaining visible momentum. To speed up the campaign, health authorities said they have newly opened 50 vaccination centers this week alone, raising the total to 257 centers.
Right. Meanwhile, Song-yeon, I hear Korea is looking to facilitate entry into the country for foreigners with a new system.
Right. So the Justice Ministry was talking about this yesterday on Thursday. Korea will launch its electronic travel authorization, or ETA system, that is, next month. So starting on Monday for nationals from some visa waiver countries. Now, this new system has been dubbed KETA. So under this new system, visitors from visa waiver countries will need to obtain an ETA at least 24 hours before getting on a plane or a ship bound for Korea by submitting required information through a website or a mobile application, according to the Ministry of Justice Thursday. For a group of visitors, one person can register up to 30 people. The system is aimed at streamlining the entry procedure at airports and to close any loopholes in the screening process. Now, KETA will be available for the nationals of 21 out of a total of 112 visa waiver countries, including the U.S., Britain, Mexico, and Ireland. The ministry said that for the remaining 91 visa waiver countries, such as those traveling to Korea for special purposes such as business, are still eligible for ETAs. KETA permits will be valid for 2 years, and ETA-only counters will be available at airports for permit holders. The program will run on a pilot basis for 4 months before it's officially launched in September.
Meanwhile, back on the vaccination front, Song-yeon, as Soa mentioned earlier, inoculations for our athletes and staff members taking part in the upcoming Tokyo Olympics have been launched.
Yes, so there's been a lot of talk on whether or not the Tokyo Olympics will be taking place at all, but especially amid the current pandemic. But regardless, athletes are preparing themselves, and Korea on Thursday started vaccinating athletes scheduled to participate in the upcoming Tokyo Olympic and Paralympic Games as well. Now, according to the Korean Sport and Olympic Committee, the first group of 100 Olympic athletes and coaches got Pfizer's vaccines at the National Medical Center in Seoul starting at 4 p.m. Thursday. The KSOC said a total of 931 Olympic and Paralympic athletes, coaches, and staff will be inoculated in 4 groups by May 4th. It said those under the age of 30, who make up around 600 of the total, will all be given Pfizer vaccines in light of the government's decision to suspend the use of AstraZeneca vaccines for that age group. Now, those above the age of 30, however, will receive the AstraZeneca vaccine sometime in May. Meanwhile, none of the 100 athletes and coaches reported any unusual symptoms or side effects after getting their vaccines on Thursday. Korean volleyball star Kim Yeon-kyung said she was worried because there has been a lot of controversy regarding the safety of the vaccines, but was able to overcome her anxiety with the help of the doctors.
I was very nervous, but the injection didn't hurt much. And I think I'll feel much more relieved when I get my second dose as well.
The Tokyo Olympics are scheduled to kick off on July 23rd and continue through August 8th after being postponed by a year due to the pandemic. COVID-19 vaccinations are not mandatory for athletes to compete in the Games, but it is recommended if vaccines are available in their home countries.
All right, Song-yeon, as always, thank you very much for the coverage.
Thank you for having me.
Right, up next, here's the regular briefing on the COVID-19 situation.
And yesterday, we had more than 241,967 people who have been administered with their first dose of COVID-19 vaccine. And currently we have 3,056,004 people who have completed their first dose inoculation. And yesterday, since the rollout of the vaccination, we had the most number of daily vaccination capacity, and we once again hit a new record high. And by April, we aimed to have 3 million inoculations, and we have achieved this, and we would like to announce this to the rest of the public. And we believe that the surpassing the 3 million mark in April was possible thanks to the participation of the people, the public, thanks to your support and participation, who have been taking part in the inoculation and who now stands at about 3.5 million people. And we once again would like to thank you again. And also we were able to achieve this goal, secondly, because at national vaccination centers and designated hospitals nationwide, we had doctors, volunteers, and nurses, and all of your efforts made it possible for us to achieve this goal. Last but not least, until now, we also had many front-line workers who have been fighting against the COVID-19, and we also have many public service members who were also taking part in our rollout, and we would like to once again thank you as well. Now the government has achieved the 3 million mark within the month of April, and since March we have been increasing the number of vaccination centers here in the country. We had 22 opened in March. However, as of yesterday, we have a total of 257 vaccination centers nationwide. And also designated COVID-19 vaccination centers stands at 13,185 nationwide as well. And among them, 2,218 hospitals have been up and running more faster than as we expected. And going forward, we will also designate more hospitals for the vaccination rollout. And with this, we would like to significantly increase our inoculation capacity and also expand the number of eligible target group as well. And originally, our aim and our plan has been on a roll smoothly, and thanks to this we have been seeing a clear decline in the number of infections at nursing hospitals and nursing homes, and we completed about 80% of the inoculation at these facilities. And also we are speeding up the vaccination rollout for essential social workers. Above all, the inoculation has helped us to decrease the rate of people who have critical symptoms and also fatalities as well. We have seen a significant decline of fatalities at nursing homes and nursing hospitals. And today, the KCDA Commissioner Chung Eun-kyung notes that the inoculation, and she also noted that in Cheongju, there was a vaccination center where she visited, and she also would like to encourage the staff members there today. And also she mentioned that in order to help us to protect the high-risk groups, we have the visiting public officials who have been visiting the nursing hospitals with the vaccines, and she would like to also mention their efforts as well. And also we have seen some reports that we do not have sufficient amount of vaccines, and we would like to have some explanation on this specific report. And in order to have our smooth vaccination rollout for senior citizens for aged over the age of 75, we would like to go speed up our inoculation, and we have enough Pfizer doses designated for these group of people. However, we have the Pfizer vaccines arriving in Korea on a weekly basis, and as of end of April, we have been focusing on the vaccine first dose, and considering that the interval for Pfizer vaccine is 3 weeks, we will be also increase the demands for the second dose vaccines for those who have already received their first Pfizer dose. And against this backdrop, on a weekly basis, we will be looking at the conditions at vaccination centers, and their capacity could reach some hurdles. And in order to have a smooth rollout of the second dose, we will be also going ahead with our scheduled first dose, which have already been reserved for. And aside from new reservations for the first dose, we ask the local governments to suspend the receiving of these new first dose reservations. And in mid and late May, we will also be resuming our focus to the first dose again. And by then, we believe that we will have also finished a large significant of numbers of the second dose vaccines for senior citizens as well. And also, second, we would like to analyze the risk factors of high infections among religious facilities, including churches. In early this year, we have been seeing a steady decline and a significant decline in the number of cluster infections stemming from religious facilities. However, this has been on a rebound, and we also have lately seen 27 new cluster infections, and there were about 640 people who were infected. And looking at the latest infections, we see that about 74% of the infections were contact with the previous confirmed cases. And as major risk factors, people did go to the physical services despite the fact that they had clinical symptoms of COVID-19, and also there were no distancing measures at the churches and the religious facilities, and they also had group meals, and they failed to comply with the quarantine measures. To this end, we ask you to comply with these quarantine measures at churches. We ask for your support as well and participation as well. And the local governments will also intensify and bolster its inspection for religious facilities going forward. And with our achieving of the goal of 3 million inoculation, we believe that we will be inoculating more people going forward, especially the high senior groups as well as essential social workers. And about 12 million will be inoculated by June. This is our goal. And we ask you to participate in the vaccine rollout when on the day if your turn has arrived. And please note that you need to get vaccinated when you have good conditions. And during the weekend, we believe that more people will be visiting the religious centers. We ask you to keep social distancing measures and comply stringently with the quarantine measures for the sake of your health and those of your loved ones. If you have any clinical symptoms, please do not visit the physical service, but immediately visit a screening clinic nearby and get tested for COVID-19. And also, please have no group meetings with your church members. Moreover, at churches, please designate a quarantine responsible employee staff, and we ask you to monitor all of the visitors and the service goers of their health conditions. And also, please restrict the number of the service members at the certain services, and also ask you to keep social distancing measures and have full compliance to ventilation. Vaccination can protect your health. It can also protect the health of the senior citizens and that of your neighbors. And it is the most effective way and the most scientific way for us to return to a state of normalcy. And as for your parents, we ask you to encourage them to get vaccinated if their turn has arrived. After inoculation, even, we ask you to comply with the face mask wearing rule, a social distancing measure, and hand washing quarantine measures as well. The quarantine authorities will also stick to the basics, and we will exert our full efforts to contain the further spread of the virus. We will also put our utmost efforts and also speed up our inoculation even more. Thank you very much.
Right, that was Friday's afternoon briefing. So what was the gist of that public address?
Well, the official called on cooperation from the nation's people on the vaccination campaign. And he did mention how the vaccine process has been expanded. At the end of March, there were around 22 vaccination centers, and that number has increased to 257 as of Thursday. And also more than 13,100 hospitals have been designated as administering vaccinations, with over 2,200 currently in operation. Also, he did stress that there should be vigilance when it comes to religious activities, because despite having seen a decline in infections related to religious services at the beginning of the year compared to last year, recently there's been a rise again. In the past month, there were 27 cases linked to religious facilities. That's 27 cluster infections, but in total 640 individual infections. And he said in some cases there were people who had symptoms but still went to in-person services. So he did ask for people to abide to regular social distancing measures.
Of course. All right, so thank you for that.
My pleasure.
Right, efforts to fight the pandemic are taking place at all levels of the government, and in this next report we highlight the dedication by local administrative divisions to ensure the safety of their residents.
A close partnership between the central government and regional authorities has become essential in the country's fight against COVID-19. Case in point, drive-through test centers and residential treatment centers both started off as local initiatives before they caught the eyes of the central government and even other countries beyond our shores. So what new ideas are being discussed by local governments as we head into the second year of COVID-19? We visited the Regional Council of Gyeonggi-do Province to find out more. The Gyeonggi-do Provincial Assembly has been holding emergency council meetings on a regular basis to roll out tangible aid measures for its residents.
방역 현장과 지역 상권, 정책 위반자가 원활하게 소통하면서 위기를 슬기롭게 극복해낼 수 있도록 지방의회가 더 큰 역할을 해야 합니다. 지금까지 1년이 넘는 운영 기간 동안 비상대책본부 회의를 150회 정도 진행했어요. 그 과정에서 550건에 넘는 제안사항을 집행부에 전달했고 이 중 65% 정도가 처리 완료됐습니다. 공공의료라든지 공중보건 관련 의료진이 절대 부족하다는 점을 지적하고 개선 방안을 요구했거든요. 그 결과 기존에 6명이던 역학조사관이 전국 최대 규모의 71명으로 확충될 수 있었고요.
Local governments have also sought to address the impact of COVID-19 on the livelihoods of their residents by providing them with emergency financial assistance. The Gyeonggi-do Provincial Assembly is now in the process of handing out its second round of emergency relief payments to all of its residents, including foreigners.
그로 인해서 손님들도 나오고 그 사주로 인해서 먹거리도 좀 나아진 것 같고 좋은 것 같아요.
The province has also spared no expense in disinfection efforts to keep its residents safe. Extra attention is being paid to the city's bus network, with some 4.4 million residents taking the bus on a daily basis. The province has set aside a budget of more than $10 million this year to keep its buses safe. The budget will be used to outfit buses with air purification filters and thermometers, as well as free hand sanitizers and face masks for passengers to use.
타시는 분들이 보면은 처음에는 좀 놀라시더라고요. 여기에 버스에 이런 게 있나. 이제 제가 설명해 드리니까 아우 역시 좋은 세상이구나 이제 그러시는 분도 있고.
열 화상 카메라가 바로바로 인식되는 점이 빠르고 좋아서 믿고 탈 수 있을 것 같습니다.
Our war against COVID-19 is being waged on a global scale, but the key to victory is winning all the smaller individual battles being fought by local communities.
A strong immune system is essential to ensuring an effective vaccine response, so say medical experts, and today we tell you why and how. I have Professor Byung-wook from Hyang University Hospital. Welcome back, Dr. Yu. And I also have Professor Sarah Ok-shin from Korea University. Good to see you again, Professor Shin.
Thank you for having me.
Right then, Professor Yu, let's begin with the link between our immune system and its role in fighting COVID-19.
Well, some people believe that immunity is a kind of imaginary systems. Actually, we couldn't make it clear what kind of immune system we have it. But we found that some of the immune system is working, that's why we still survive. So how we can link to between the COVID-19 and the immunity system? Since we were birthed from our mother, we started to have a vaccination. So bundle of vaccination we have done. That's why we can guarantee at least 80 years long. It's like the new human being's life. Only the 100 years before, expected of life around 40, not only for World War I and World War II. Because we got it the boosting with the vaccinations, and then finally we got the strong immunities. We can survive because we live the same Earth, because Earth never change. So viruses never change, never gone. Always we live surrounded some kind of virus in bacteria. But anyway, so the modern life is better hygiene, and we can do eating for a better food supply. So we have a build up the immune systems. So if we build up the good immune system, probably we can win against not only COVID-19, unknown, not showing yet the virus, also we can overcome it.
I see. Professor Shin, according to US researchers, mutations of the coronavirus are much more likely in patients or people who have weak immune systems. Could you explain this for us?
Yeah, so, well, like other viruses, coronaviruses collect mutations when they replicate in our cells. And for most healthy people, usually viruses can, infect the host cells, and an active infection lasts about a week or 2 weeks until immune cells start producing antibodies to get rid of the virus-infected cells. So the viruses don't really have time to really, gain mutations, if any. But for immunosuppressed people, the viruses usually persist longer, for more than a few months, because they don't have a proper immune response to get rid of the virus. And so viruses have longer, period of time to keep evolving and mutate. So I think that's probably why these immunosuppressed people are the easy targets for the virus, and mutations can be collected during this in this host of immunosuppressed people.
Then this same study that I was talking about talks about how an immunosuppressed patient saw 50 different mutations in its genetic code in a span of 150 days. Does that make the coronavirus then much more deadly?
Oh, right. Yeah. So I mean, so I guess the immunosuppressed people could be incubator of these mutations that keeps accumulating, right? So it could be that these mutant viruses could be more powerful when they go to other people and then transmit to other people. So it is quite possible.
I see. Meanwhile, Professor Yu, it has also been said that a strong immune system ensures a more effective vaccine response. Could you explain this for us?
Well, kind of the funny. Why? Young people state that we don't need a vaccination. But you know what? Younger people, whenever they get vaccinated, is the persistence of the antibody and the powerful immunity longer than older people's. Why? They are fresh T cell, B cell, NK cell, kind of immune cell, which is the more active, and they can make the more productive antibodies against the virus or bacteria from the outside of the body. So younger people had it, they have the more longer period of the immunities, and this also more strong level of immunity we already checked in the laboratory level of the research. So if there are 20s, 30s, 40s, youngest people in Korean community, they start to the vaccinating, I'm quite convinced this surge of the COVID-19 of the crisis will be cut off and cut down more quickly. But at the same time, the older people who are the immune system not strong enough as like before the young, but this is booster one, you got it more shield and the shielding of your bodies from against the COVID-19.
Right. Staying with the same logic then, Professor Shin, can a weak immune system render the COVID-19 vaccine ineffective?
Yeah, so vaccines might not be as effective for those who are suffering from like cancer or autoimmune disease that have that don't have fully functional immune system. That's because they are incapable of producing immune cells that neutralize antibodies against the COVID-19. So these immunosuppressed people usually don't have functional immune system, and that's probably why they have lower efficacy against the vaccine. So we have to think about maximizing the vaccine efficacy for those who have challenging immune system. So one thing we can do is to give higher dose or more extra dose of vaccines for these people, and perhaps we could think about using monoclonal antibodies treatment. And also, it should be noted that these people, although they don't have fully functional vaccine efficacy, vaccines can still provide them, the prevention from severe outcomes like death and hospitalization. So the vaccination is still important for those who are immunosuppressed.
Right, so active immunity as well as passive immunity.
Right.
Professor Yu, some claim that getting enough sleep is essential to boosting our immune system. How much sleep are we talking about?
While all the mother never long, because mom said you have to get sleep well, you'll be fine. That is true because we have evidence. So let's see the glance of the another evidence of the cancer. So I'm so thankful for their service in the overnight while we are sleeping, like a nurse who worked the nighttime and the night guarders. Unfortunately, their cancer risk is higher than other groups of the workers. So we are thinking about it. The cancer genius cell, it can be we can call it inflammatory cell agent. It can be attacked our organ, can be developed cancer. There are many regions of the cancer region, but it can be one of this. But who have a good sleep, their immune system can be like the severe, like a petrol, to help to the kill and get rid of the inflammatory cell can cause the cancer. So which is the same ideas that if you have enough to sleep, like 6 to 8 hours of the night, would depend on the person, but you feel enough, get off the enough and clear, and your body will be well. So I believe that time your natural immune system is working on it well. So never wrong, the mother said.
I see. On average, Professor Yu, are we talking about like 8 hours of sleep a night then?
Well, so it depends on. Some people said I need only 4 hours, that enough to cover my activities for long, but who need more than 12 hours. But there are one thesis about the sleeping time, especially the babies sleep nearly all day. But it's the elderly people, 6 hours will be enough. Even the morning time with the wake up, I'm already started, so 5 a.m. my eyes automatically open it. So probably this is the kind of the bio-clock theory, so which means young people need more sleep because their immunity is not mature, so they need the time to recover themselves while they sleep. But who are build up their immune systems well, 6 to 8 hours will be enough, but generally we recommend at least 7 to 8 hours per night.
I see. Meanwhile, Professor Shin, obesity is known to impair immune function. Now, having said that, can we assume then that obesity may hinder COVID-19 vaccines?
Yeah, so obesity is definitely a major risk factor for morbidity and mortality for COVID-19. And it is true that obese people are less likely to develop, effectiveness against the COVID-19 for the vaccine. And that's because there's a close link between obesity and the immune system. And as Dr. Yu have mentioned, inflammation is the key here. because obese people are likely to have a low grade of inflammation because, adipose tissue usually, store fat and energy, but also they can be major producers of hormones and as well as pro-inflammatory cytokines and chemokines. So more adipose tissue you have, obese people will likely to have, more adipose cells to produce cytokines and chemokines, and that gives them a shift towards pro-inflammatory conditions. And that has a negative effect on the immune cells to produce antibodies. So there's definitely, an effect on, of the obesity on the immune response. So I think we have to think about, having obese people, keeping eye on obese people to maximize the vaccine efficacy by maybe giving them a higher dose or extra doses of vaccine if it's possible.
Right. Professor Yu, aside from sleep now, I've been told that eating habits are also very important in strengthening our overall immunity, that is. What should we be eating then?
Well, in the SARS, MERS, and COVID-19, many people the comment about the kimchi is one of the permanent food have helped immunities. But before we talk about what kind of food helped the immunity, we have to take care about, we must watching out about certain food, the mention about it. So a couple of weeks before, in the dairy product manufacturing in Korea, so they announced about some dairy product helped in the stopping the COVID-19 was a big shock. Now the government is having some kind of process of punishings about this. So which is the best food can prevent and help to this is the kind of COVID-19 something? But I can tell, immune system is supporting by balanced diet. So why we are focused on kimchi? Kimchi is a kind of balanced fibers and enough to some ingredient like the garlics and the chili peppers, which is combined. That's what will help. But for me, I have a lot of German friends. They told me that, oh, kimchi I couldn't because my stomach is burnt and hot. But I'm asking them, which one is the best food for your children? Sausage. Yes. But the Korean mom said, how? Which means depend on the nature and depend on the traditional way to, probably each country, each culture, they have own answer for it. But basically, scientifically, I like to answer about it. Immunity is built up from balanced diet, especially for the protein. So the aged elder people's protein consume is decreased, their immunity is down together. So which one is the best? So having the good dinner today, all the people and the family member is invited at home, having the kind of the palm size of red meat or chicken meat, so how to cook, delicious way, and enjoy the dinner would be good for you.
Thank you for that, Professor. Professor Shin, let's now touch upon the local COVID-19 situation. We've been recording more than 600 cases over the past week. What worries you the most about our current situation?
Yeah, so I'm mostly concerned that, I guess 45% of these cases, COVID-19 cases currently are, from unknown infection sources. And mostly, these are in small infection clusters with family and friends. So it's very hard for us to track down where these infections come from. And that's very worrisome. And also, we only have about 5.6% of population having this first vaccination done. And we have, a long way to go until we reach the herd immunity. So, it's just very concerning time. And also, the May is around the corner. Tomorrow is May already, and the weather is getting warmer, and we have so many, celebration and holidays coming up in May, Children's Day, Parents' Day, and Buddhist Day. So I think people are likely to gather more and spend time together, and we might see more cases come up, go up coming months. So that's very worrisome.
Right, especially if people don't abide by safety precautions.
Right.
Professor Yu, self-testing kits are now available for purchase amid concerns, of course, about their accuracy. Personally, do you believe they are helpful or harmful in curbing contagion?
Today I prepared for the positive answer, negative answer together. Positive answers mean so person who has symptoms, I mean the no symptomatic. Most of the people who are catching cold, but they're so afraid of going to the hospital because I'm in COVID. But even they feel like that, they don't want to go there. But there are many reasons. But who has the symptoms, you can do the self-test kit at home with the instruction. And then if you have any condition, we can find it, better to go to the screening center of the COVID-19 or the hospital, make sure. But I'm not highly recommended no symptomatic person. Negative mean what you concern. So sensitivities mean who had the disease, we confirm, yes, there are disease. Sensitivity is still lower than traditional RT-PCR, that's my concern. It's a negative answer because people can be confused. For example, if you do this test kit in the whole like a high school member around the 1,000 who got the positive, we should be close to school. But who did the RT-PCR, the repeated coming negative, is kind of a shock, and the real life will be shut down. So this is we are very carefully assess, but I highly recommend who a positive answer, who has the symptoms of the COVID. Yes, you can do in the safe place, in the safe measure, long stick put through the nose, and touch it, and put the stick in some solution, and then put down. After finish that, should be the wrap, and the clean side, you must bring to the community health center for the discard. There we mark it. So, and less than 18 years old, we not recommend it because region to the block of the respiratory system. So if you want it, read it carefully, and how to do, separate it, and the safety area, and should be cleaned well to prevent of infection for other persons.
I see. So if you do test positive, you need to take that kit to the center with you to dispose of it there.
Correctly.
I see. Professor Shin, from next Wednesday, those who've been fully vaccinated here in Korea will be exempt from the 2-week self-quarantine period in case you come across a person who's been infected or if you're coming in from abroad, provided that you test negative, of course. What are your thoughts on this plan?
Well, I think it's a positive news, and it's a good news that, government is being a little more flexible, applying different rules for these people who have traveled from the abroad or who have contacted the COVID-19 case person. But if the person is vaccinated, it's the person won't be is not a person. Will be protected from the infection, most likely. So I think it's very good that government is being more flexible, and I think it'll hopefully increase the people to get the vaccination more, coming weeks.
Right, hopefully.
Yeah.
All right, Professor Shin, as always, thank you very much for your thoughts, and Professor Yoon, as always, thank you for your insights. Right, now as our medical experts here in the studio have said, remember to get proper rest and proper nutrition to boost your immune system and its ability to fight COVID-19. Thank you for watching. Have a safe weekend.